Hi, I'm Dr. Jeff. I'm an advanced trained non-surgical disc specialist, chiropractic veteran of 20 plus years, as well as a fellow for primary spine care candidate. Welcome to our case history, where we're going to discuss case histories that might sound just like what you're going through. And what I'm going to do in these case histories is I'm going to explain to you the patient history, the examination findings, what we did, what we discovered, and then how we helped the patient out. And some of these case histories might sound just like you. This is case 01. In 01, SK came in after spending 3 years at other chiropractic offices within our local area, letting them know she had neck pain as well as pain that kind of referred into her shoulder a bit. She had seen other practitioners, and when she was in front of us, she was very emotional. And the reason she was emotional was because she felt like she hadn't been heard and listened to. She had spent lots of money and was out lots of money. And when she had told the doctor and staff that the last place she had gone to, hey, listen, my neck and shoulder are still hurting me, there's more going on, she was told, oh, you just need more care, you need more care. So she was very standoffish in our consultation examination. Although she wanted to be there, she was very standoffish because, hey, she had been ripped off and taken by other chiropractors within our area. So immediately we put her at ease and said, listen, we're advanced trained non-surgical disc specialists and chiropractic veterans. We're more of a specialty clinic. We're not here to rip you off. We're here to, number one, get a proper diagnosis. The number one thing we do is we get a proper diagnosis with proper testing before we do any treatment whatsoever. Again, to see is to know, to not see is to guess, and we want to make sure we know exactly what's going on with the patient, because we want to know, hey, is it 100% us and spine, or is there something else going on that we need to co-manage with other doctors? So we put her at ease right away, said, this isn't about your money, let's figure out what's going on, and then we'll determine a plan. So we did an initial examination, and we did a test called palpation, where we felt along her neck and asked her, you show us first where you feel it. She touched a portion in her neck and kind of went down to here. And then we touched doing what's called palpation, and we discovered that right towards the middle part of her neck was the worst type of pain she had. We looked at the x-rays. We then did what's called a orthopedic test, where we compressed and twisted and turned. And based on her history, this has been going on for quite a long time, more than 3 years. The fact that her x-rays showed that she'd lost the curve in her neck, and when you lose the curve in the neck, the head goes forward. For every inch the head goes forward of the shoulders and hips, the head weighs an additional 10 pounds. So her head was forward at least a full inch, which means her head went from 10 pounds to 20 pounds. And when that happens, you compress the discs in the neck. So based on that, based on her history, based on our palpation or touching, based on her touching, and based on what's called orthopedic testing, we said, we think more is going on. We think there's a disc injury. We need an MRI. So we got MRI, and we read our own MRIs. There's a 43.6% error rate in the radiology report. So we read our own MRIs, not just the report. So we grabbed her MRI, and when she brought it back to us, we put it in the MRI, we put it in our machine. We looked at the MRI and we read it. We discovered that she had bulges at C2 and 3, a bulge and a herniation at C3 and C4, a herniation and a bulge at C4, C5 with a tear in the disc, a herniation at C5, C6, and a bulge at C6 and 7. So although she was receiving treatment from these other chiropractors, no one had done an MRI to diagnose exactly what was going on. So they were basically treating her blind. And so she'd had enough. We discovered what was going on, and we said, look, we think the problem is the C4, C5 with the bulge, the herniation, and the tear, because that can be right where you touched, as well as come down into the neck and shoulder. We created a care plan for her, and in the care plan, we said, because you've had bad experiences in the past, let's do a shortened, abbreviated care plan. Now, one of the things we've done after 5,000 disc injuries repaired is we can give what's called a prognosis. Prognosis means we can tell you, based on research that we've done and gotten data and feedback from patients, we know what percentage you should feel better given a certain time and how your care should project. And if it's not going that way, we know something's wrong. So we said, let's do an abbreviated care plan. We won't do a whole care plan, although this is what we think you're going to need. Let's do an abbreviated care plan. And based on that abbreviated care plan, When we get to this point, we'll then know, hey, if you've progressed this far, great. If not, then we need to make a switch. There's something else going on, which she agreed to. So we started care with her, and she was very happy. We use what's called dose, and the dose helps our disc injury patients recover quite well. And we were moving along, and we got to a certain point, and she said, I'm feeling better. I want to continue on with you guys. I'm just nervous. Now, a big thing in our office is patients will tell you everything if you just ask the right questions and listen. So one of the things I said, well, what are you nervous about mostly? She said, well, my neck feels good, my shoulder feels good, but I'm nervous if I go back and do what I want to do, it's going to hurt again. I said, okay, here's what I want you to do. Before we continue on, I want you to go home this weekend and do everything you think you want to do that could cause a problem. Come back on Monday and let's discuss it. Sure enough, she came back on Monday. She came into the office with me and she said, look, my neck feels great. I'm having a problem down into my shoulder and my arm again. I was looking down, I was sewing, I was reaching out, I was doing this, I was reaching up, and I said, hold on a second. I said, pause for a second. I think you just told me everything. The neck feels good. When you look down, it bothers you, but a lot of what you're reaching and using the arm is what was causing the pain? Yes, that's right, Dr. Jeff. I said, okay, have a seat. Let me check something. So I actually did a few tests on her rotator cuff, her supraspinatus, her subscapularis, infraspinatus, and her teres minor. I did some testing, preliminary testing, and she failed them all. And I said, SK, I think you also might have a rotator cuff problem. And her eyes got big. She said, you know, I've been saying I've had a shoulder problem forever and no one's listened to me. I said, listen, with where you have all the damage in your neck, you can also feel it in this area, and that's why it could have been confusing. But before we move on, are you okay with doing an MRI of your shoulder? Because I think we have two problems going on. And sure enough, she said, please, let's do it. We immediately sent her for an MRI, and the next day we got the report back. And the report actually showed she had a full thickness tear of the supraspinatus tendon, a low-grade partial thickness tearing of the subscapularis and infraspinatus, and she possibly had a tear of the biceps tendon. So lo and behold, when we told her that, we said we've discovered the complete problem. Yes, you have disc injuries and you have a rotator cuff injury. If we wind up getting surgery of the rotator cuff and we work on the neck, you should feel great. So ladies and gentlemen, this was a case of a patient who wasn't listened to, who wasn't completely and properly diagnosed because she was receiving care without an MRI, without an x-ray, and without the doctor even recognizing there could be a shoulder issue. So we are happy to report that this patient is happy. They are going to go for surgery. We've got a great doctor we're going to send her to. Her neck feels better. That part's taken out. Why? Because there's two parts of the problem. And a lot of times with our patients, as experts of the spine, we also must be experts to rule out other issues like rotator cuff, carpal tunnel, hip socket injuries in order to really get the full diagnosis for the patient. So again, this is another successful case where we were able to diagnose the patient completely, get her past her fears, get her neck feeling great, we can get her shoulder feeling great, and get her back to living life. I'm Dr. Jeff, an advanced trained non-surgical spinal disc specialist and chiropractor, as well as a candidate for Fellow of Primary Spine Care. Again, case 01SK, happily reports we've diagnosed and we've got her in the right pattern, going in the right direction.